Many people believe a stroke arrives like a bolt from the sky. No warning, no signal, just sudden devastation. But I want you to stop and really consider something right now. What if your body has been quietly sending distress signals for weeks, even months, before a stroke actually occurs? What if those signals are so subtle, so easy to dismiss, that most people wave them off as stress, poor sleep, or just getting older? Because here is the truth that no one talks about loudly enough. Strokes are rarely truly sudden. The warning system exists, and if you know what to look for, you have a fighting chance to stop one before it happens. I'm Dr. Alan Miller, and after 18 years treating cardiovascular risk in older adults, I've seen firsthand what happens when these warning signs go ignored. And I have also seen the extraordinary outcomes when they are caught in time. By the end of this video, you are going to know the 7 warning signs that can appear months before a major stroke. You are going to understand why they happen, what is actually going on inside your blood vessels and brain, and most importantly, what you need to do the moment you notice any of them. I need to warn you about sign number 5 right now, because it is the one most commonly dismissed as nothing, and it is often the most dangerous. Here is what frustrates me most in my practice. The average person spends less than 15 minutes with their doctor at a routine appointment. There is simply no time to have a thorough conversation about what early vascular warning signs actually feel like. We talk about blood pressure numbers. We talk about cholesterol. But we rarely have the time to say, here is what your body might be telling you in the months before something serious happens. That gap in communication is not your fault. It is a structural problem in how we deliver health care. But today, right here, we are going to close that gap completely. I want to start with a patient I will call Dorothy. She came to see me about 18 months ago, a 71-year-old woman who described something that had been bothering her for about 3 months. She kept waking up with a strange visual disturbance. Just for a few seconds, the upper right portion of her vision would go slightly blurry, or, as she described it, like someone smeared a small patch of Vaseline on a window. Then it would clear up completely. She had mentioned it to a friend who told her it was probably just dry eyes. She had Googled it and found articles about screen fatigue. She almost didn't mention it to me at all. But she did. And that brief, almost embarrassed mention almost certainly saved her life. Because what Dorothy was experiencing is one of the clearest early warning signs that a stroke may be building. We will come back to Dorothy. But first, let us go through the science behind why these warnings happen at all. Your brain is the most metabolically demanding organ in your body. It represents roughly 2% of your body weight, but consumes approximately 20% of your oxygen and glucose supply. That demand is constant and unforgiving. Even a brief interruption to blood flow, even for just a few seconds, can produce noticeable symptoms. What most people do not know is that before a major stroke, the brain often experiences what neurologists call transient ischemic attacks, or TIAs. These are sometimes called mini-strokes. But that term is misleading because it makes people think they are minor. They are not minor. A TIA is your brain sending out an alarm. It is your body's version of a fire drill, and you need to treat it like the building is actually on fire. Stay with me, because what comes next is the part of this video that most people have never heard explained clearly before. Warning sign number 1 is sudden, brief, visual disturbances. This is what Dorothy experienced. When a blood clot or piece of arterial plaque temporarily blocks blood flow to the visual cortex at the back of the brain, or to the ophthalmic artery that feeds the eye itself, vision is affected. It might look like a gray curtain descending over one eye. It might look like a flickering in one corner of your visual field. It might be a few seconds where colors look washed out on one side, or where a patch of your vision goes completely blank and then returns. The critical detail here is that it happens in one eye or one side of your visual field, not in both equally. This asymmetry is the neurological fingerprint of a vascular event. It is not a headache. It is not general blurriness. It is one-sided, brief, and transient. If this is happening to you, even occasionally, even if it resolves completely within seconds, you need to speak to your doctor urgently. This is not a wait-and-see symptom. Warning sign number 2 is a sudden, unexplained, severe headache. Not a typical tension headache, not the kind that builds gradually when you are dehydrated or stressed. I am talking about what neurologists describe as a thunderclap headache, a headache that arrives at full intensity almost instantly, like someone has struck the back of your head. Patients sometimes describe it as the worst headache of their life. When a blood vessel in or near the brain begins to leak or rupture, which is the mechanism behind hemorrhagic stroke, this is often the sensation that precedes it. The bleeding irritates the sensitive lining around the brain, and the pain is immediate and severe. If you ever experience a headache that fits this description, do not take a painkiller and lie down. Call emergency services immediately. This is a medical emergency. But here is the subtler version that is even more commonly overlooked. Some patients describe a pattern of mild but unusual headaches that have been occurring for weeks. Not thunderclap, just different. In a new location. A pressure behind one eye. A dull throb at the base of the skull that was not there before. These can indicate gradually worsening vascular pressure. They deserve attention. Let me introduce you to a man I will call Gerald, 74 years old. Gerald had been having occasional headaches at the base of his skull for about 6 weeks. He had attributed them to sleeping on a new pillow. His wife had encouraged him to mention them at his next appointment. Gerald was somewhat reluctant. He did not want to seem like he was complaining. When he finally did mention them, combined with elevated blood pressure readings we had been monitoring, we immediately ordered imaging. We found significant narrowing in one of his carotid arteries, the main vessels in your neck that supply blood to the brain. Gerald underwent a procedure to address that narrowing. He has not had a stroke. Those 6 weeks of headaches were his body asking for help. Warning sign number 3 is sudden weakness or numbness on one side of the body. This is perhaps the best known symptom, but what people do not always know is that it can come and go. It may last for 2 or 3 minutes and then resolve completely. You might notice your right hand feels oddly heavy or uncoordinated. You might drop something you did not intend to drop. One side of your face might feel slightly numb, like the lingering effects of dental anesthesia wearing off, except there was no dental procedure. Your left leg might feel strangely weak for a few minutes while walking, and then return to normal. Because these episodes resolve on their own, people convince themselves that nothing is wrong. They do not. They are transient ischemic attacks, and each one carries a significantly elevated risk of a full stroke in the days or weeks that follow. Research published in major neurology journals has consistently shown that the risk of a major stroke within 90 days of a TIA can be as high as 10 to 15%, with the highest risk concentrated in the first 48 hours. Do not dismiss these episodes because they went away on their own. Warning sign number 4 is sudden confusion or difficulty understanding speech. This one can be frightening. You are in the middle of a sentence, and suddenly the words feel tangled. Someone is speaking to you, and for a moment, you understand the sounds, but not the meaning. You reach for a word that you know perfectly well, and it simply is not there. You might feel momentarily disoriented about where you are, or what you were just doing. These episodes of sudden cognitive disruption, even if they last only 30 seconds and then pass, are the brain struggling with interrupted blood flow to the areas responsible for language and comprehension. In the left hemisphere, Broca's area handles speech production. Wernicke's area handles comprehension. When blood flow to these regions is compromised even briefly, the effects are immediate and distinctive. If this is happening to you or to someone you love, take note of when it happens, how long it lasts, and whether it is recurring. That information is vital for your doctor. I want to pause here and remind you of something important. If you are currently taking any medications for blood pressure, blood thinners, or cholesterol management, please do not stop or change any medication based on anything you hear today. Always speak with your doctor before altering any prescribed treatment. What I am sharing with you is information to help you recognize warning signs and have informed conversations with your healthcare team. Your individual medical situation is something only your doctor can fully evaluate. Warning sign number 5. This is the one I mentioned at the start, the one I consider the most dangerous, not because it is the most severe symptom, but because it is the most invisible. And that is sudden, brief episodes of dizziness or loss of balance. Think about how easy it is to dismiss dizziness if you are over 60. We live in a world that has normalized dizziness as a side effect of getting older. You stand up too fast and feel lightheaded. You chalk it up to inner ear changes, or low blood pressure, or not drinking enough water. And while all of those causes are real and common, there is a specific type of dizziness that is neurological in nature and not benign at all. It is dizziness that comes on suddenly, without any obvious trigger. It may be accompanied by a brief sensation of the room spinning. There may be sudden difficulty walking in a straight line, not from intoxication or inner ear congestion, but from momentary loss of coordination that feels almost electrical. It may be accompanied by brief double vision. This constellation of symptoms, sudden dizziness, imbalance, and possible double vision, points to the posterior circulation of the brain, which includes the cerebellum and brainstem. A stroke in this region is particularly serious because this part of the brain controls vital functions. And yet, because dizzy spells are so common and so easily dismissed, patients wait. They sit down, feel better, and decide it was nothing. Please do not let that be you. Let me tell you about a woman I will call Rosemary, 68 years old, active, and in generally good health. She came in for a routine appointment and mentioned almost in passing that she had had a couple of episodes over the previous month where she had briefly felt extremely unsteady. She described it as if the floor had tilted for a few seconds. Each episode had lasted less than a minute. She had told herself it was fatigue. She had not fallen. No one had seen it happen. She almost left it off her list of things to mention. We ran imaging that week. She had a significant blockage in the vertebral artery, one of the primary arteries feeding the posterior brain. She was referred immediately. Rosemary is doing well today, but the outcome of that story changes entirely if she had kept that detail to herself for another 6 months. Warning sign number 6 is sudden difficulty swallowing. This one surprises many people. Dysphagia, difficulty swallowing, is not only a symptom we see after a stroke has occurred. It can appear as an intermittent warning sign in the lead-up to one. The brainstem controls the complex muscular coordination required for swallowing. When circulation to the brainstem is compromised, even temporarily, the swallowing reflex can become impaired. You might notice food or liquid going down the wrong way more frequently than usual. You might feel like there is a brief moment of hesitation or partial blockage when you swallow, particularly with certain textures. You might notice a change in your voice quality after eating, a slight hoarseness or wet quality that was not there before. In isolation, any of these could have a benign explanation, but in combination with other warning signs on this list, they deserve immediate medical attention. Warning sign number 7 is a sudden, brief episode of slurred speech. Not related to alcohol, not related to extreme fatigue. A moment where words come out slightly garbled, where the muscles of your mouth feel momentarily uncooperative, where someone you are speaking to asks if you are all right because something in your speech sounded different. This is one of the classic hallmarks of a stroke in progress, and it can appear in transient form as a warning sign weeks or months before a major event. The motor cortex and the tracts that connect it to the muscles of the face and mouth are exquisitely sensitive to interruption of blood flow. Even a brief disruption can produce that unmistakable slurring effect. If this has happened to you, even once, even for 30 seconds, please tell your doctor. Do not wait for the next routine appointment. Call and ask to be seen sooner. I want to take a moment to talk about something that ties all 7 of these warning signs together. They share a common theme. They are transient. They are brief. They resolve on their own. And human nature being what it is, when something painful or frightening goes away, we exhale and move on. The brain is extraordinarily good at normalizing experiences that repeat. After the second or third episode of a particular symptom, it starts to feel familiar rather than alarming. That process of normalization is one of the greatest threats to your vascular health. The disappearance of a TIA symptom is not reassurance. It is a window of opportunity, and that window does not stay open indefinitely. Now let me bring this home with something actionable, because information without action is just anxiety in a new outfit. If you recognize any of these 7 warning signs in yourself, here is exactly what to do. First, document it immediately. Use your phone's voice recorder or the Notes app to capture the time, the duration, and what the symptom felt like. This information is clinically useful and will help your doctor significantly. Second, call your doctor within 24 hours. Do not wait for your next scheduled appointment. Tell them you have experienced a potential TIA symptom and use that exact language. That phrase will get you appropriately prioritized. Third, avoid all strenuous activity until you have spoken to your doctor. Elevated blood pressure during exertion can be a trigger for a full stroke if your arteries are already compromised. Fourth, if you experience multiple symptoms simultaneously, sudden weakness on one side, speech difficulty, vision changes, severe headache, confusion, do not call your doctor's office. Call emergency services immediately. Use the FAST acronym: face drooping, arm weakness, speech difficulty. Time to call emergency services. Fifth, bring someone you trust to your medical appointment. When we are anxious in a clinical setting, we often forget to mention important details. A second set of ears helps ensure that nothing gets left out. There is a reason the medical community is investing significant research into the window of time before a stroke. Because everything we know about how strokes unfold tells us that the period leading up to one is not silent. The body speaks. The vascular system speaks. The brain sends signals. The tragedy is not that the warning signs do not exist. The tragedy is that we have not been taught to listen for them in the right way. You are listening now, and that changes everything. Please take 1 minute right now and think about the people in your life who are over 60. A parent, a sibling, a neighbor, a friend. Any of these 7 warning signs could be happening to someone close to you right now, and they may be doing exactly what most people do, quietly dismissing it, attributing it to age, deciding not to make a fuss. Share this video with them, not as a scare tactic, as an act of genuine care. You might be giving someone a second chance they did not even know they needed. Now I want to hear from you. Have you or someone you love ever experienced any of these warning signs and written it off? Drop your experience in the comments below. Your story might be the thing that encourages someone else watching this video to finally pick up the phone and call their doctor. And in our next video, we are going to talk about the specific foods and lifestyle habits that have been shown to meaningfully reduce stroke risk in people over 60, including one dietary shift that most doctors never mention, but the research on it is remarkable. You are not going to want to miss that one.